Access to healthcare is a fundamental human right, yet for millions, the high cost of medicines makes treatment a distant dream. Generic medicines offer a lifeline, dramatically reducing the cost of essential drugs. They contain the same active ingredients as brand-name versions but are available at a fraction of the price. This affordability is a game-changer. Take the example of HIV/AIDS treatment. In the 1990s, antiretroviral drugs were prohibitively expensive, costing over $10,000 per patient per year. The introduction of generic versions brought the price down to less than $100 per year. This price reduction was instrumental in expanding access to life-saving treatment in developing countries. This example is not an isolated incident. Across a range of diseases from diabetes to cancer, generic medicines have made treatment accessible to millions who could not afford it otherwise. This affordability not only improves individual health outcomes but also strengthens families, communities, and entire economies. The impact of generic medicines extends beyond cost reduction. They also play a crucial role in increasing the availability of essential medicines, particularly in low- and middle-income countries. When a patent on a brand-name drug expires, multiple manufacturers can enter the market and produce generic versions. This competition leads to increased production and wider distribution. Suddenly, medicines that were once scarce and expensive become readily available at affordable prices. This increased availability is particularly significant in remote areas and underserved communities. For instance, in many parts of Africa, generic anti-malarial drugs have become widely accessible, leading to a significant decline in malaria-related deaths. This positive trend underscores the transformative power of generics in addressing global health challenges. Universal health coverage, or UHC, is a fundamental goal for a just and equitable world. It means that everyone, regardless of their income or social status, should have access to quality healthcare services without facing financial hardship. Generic medicines are indispensable in achieving this vision. By making medicines more affordable, generics reduce the financial burden on individuals and governments, freeing up resources that can be invested in strengthening healthcare systems. This includes building hospitals and clinics, training healthcare workers, and expanding access to essential services. Furthermore, the availability of affordable generics allows governments to include a wider range of essential medicines in their national health programs, ensuring that more people have access to the treatments they need. This is particularly crucial for addressing chronic diseases like diabetes and hypertension, which are on the rise globally. Public health systems, especially in resource-constrained settings, rely heavily on the availability of affordable medicines. Generic medicines form the backbone of these systems, enabling them to provide essential healthcare services to a larger population. The cost savings generated by using generics can be redirected towards other critical areas, such as disease prevention, health education, and infrastructure development. Moreover, the widespread availability of generic medicines fosters competition in the pharmaceutical market, driving down prices even further. This virtuous cycle of affordability and access helps to create a more sustainable and equitable healthcare system for all. In conclusion, generic medicines are not just cost-effective alternatives, they are transformative tools for global health equity. Their impact extends far beyond individual patients, strengthening healthcare systems, supporting universal health coverage, and ultimately contributing to a healthier and more just world.